Sciatica pain is most commonly caused by irritation or compression of the sciatic nerve, the longest and largest nerve in the human body. This nerve originates in the lower spine, passes through the hips and buttocks, and travels down each leg. In adults over the age of 60, sciatica is frequently associated with age-related changes such as disc degeneration, spinal stiffness, reduced joint mobility, and tightness in the hip and gluteal muscles. These factors can increase pressure on the nerve, leading to symptoms such as sharp pain, burning sensations, numbness, or tingling that radiate from the lower back into the leg. The gentle seated stretch highlighted in this exercise is specifically designed to reduce pressure on the sciatic nerve in a safe, controlled, and joint-friendly manner. Unlike aggressive stretching or high-impact movements, this exercise places the body in a stable seated position, significantly lowering the risk of imbalance or injury. This is particularly important for older adults whose balance, reaction time, and joint resilience may be reduced. From a biomechanical perspective, the seated stretch works by targeting the muscles surrounding the sciatic nerve, especially the piriformis, gluteus maximus, and deep hip rotators. When these muscles become tight or shortened, a common occurrence with prolonged sitting, reduced physical activity, or age-related muscle stiffness, they can compress or irritate the sciatic nerve. By gently crossing the leg and leaning forward slightly, the stretch lengthens these muscles, creating more space around the nerve pathway. This reduction in muscular tension helps decrease nerve compression and can lead to noticeable pain relief. One of the key strengths of this exercise is its emphasis on slow, controlled movement. Rapid or forceful stretching can trigger protective muscle contractions, which may worsen pain or cause additional strain. In contrast, slow movement allows the nervous system to remain calm and receptive, allowing muscles to relax rather than resist. This neuromuscular relaxation is essential for effective pain relief, particularly in individuals with chronic discomfort or heightened pain sensitivity. Breathing also plays a critical role in the effectiveness of this stretch. Deep, steady breathing during the exercise promotes parasympathetic nervous system activation, often referred to as the body's rest and relax response. This state reduces overall muscle tension, lowers stress hormones, and improves circulation. Increased blood flow delivers oxygen and nutrients to the affected tissues while helping remove metabolic waste products that may contribute to inflammation and pain. For seniors, improved circulation is especially valuable as blood flow naturally decreases with age. Another important advantage of this seated exercise is spinal safety. Many sciatica exercises involve floor-based movements or twisting positions that may place stress on the lumbar spine. For older adults with conditions such as osteoporosis, arthritis, or spinal stenosis, these movements can be uncomfortable or unsafe. The seated position keeps the spine in a neutral, supported alignment while still allowing the hips to move freely. This minimizes spinal loading while maximizing therapeutic benefit. Immediate pain relief is often reported with this stretch because nerve pressure is reduced as soon as muscle tension decreases. Unlike medications, which primarily mask symptoms, this exercise actively addresses a contributing mechanical cause of sciatica. While medications may offer temporary relief, they do not improve mobility, flexibility, or muscle function. In contrast, this stretch actively improves the underlying conditions that contribute to sciatic nerve irritation. It is important to note that the goal of this exercise is not to push into pain. Mild stretching discomfort is acceptable, but sharp pain, numbness, or increased tingling should be avoided. The stretch should feel controlled, gentle, and manageable. This pain-aware approach is especially important for older adults whose tissues may take longer to adapt and recover. Consistency rather than intensity is the key to long-term improvement.
Over time, regular practice of this gentle seated stretch can lead to sustained reductions in sciatica symptoms. As hip mobility improves and surrounding muscles become more flexible, the sciatic nerve is less likely to become irritated during daily activities, such as walking, standing, or sitting for extended periods. Improved hip function also reduces compensatory strain on the lower back, further decreasing the likelihood of recurring pain episodes. From a functional standpoint, this exercise supports independence and quality of life in older adults. Sciatica pain often limits basic activities, such as getting out of a chair, climbing stairs, or walking short distances. By reducing pain and improving movement efficiency, this stretch helps seniors maintain confidence in their physical abilities. This can have positive effects not only on physical health, but also on mental well-being, as chronic pain is closely linked to anxiety, frustration, and reduced social engagement. In summary, this gentle seated stretch is an effective, low-risk method for reducing sciatic nerve pressure in adults over 60. By relaxing tight hip and lower back muscles, improving circulation, and maintaining spinal safety, it provides both immediate and long-term relief from sciatica pain. When performed slowly, with controlled breathing and proper posture, it offers a practical alternative or complement to pain medication, supporting healthier movement and greater comfort in daily life.
As people age, pain and discomfort are not caused solely by weak muscles or stiff joints. They are often the result of altered movement patterns that develop gradually over time. In adults over 60, years of compensatory movement, prolonged sitting, reduced activity, and fear of pain can lead to inefficient posture and poor coordination between muscles and joints. These changes increase mechanical stress on the lower back and surrounding nerve structures, including the sciatic nerve. The seated exercise discussed here plays an important role in retraining these movement patterns in a controlled and low-risk manner. Neuromuscular coordination refers to how effectively the nervous system communicates with muscles to produce smooth, efficient movement. With aging, this communication can become less precise. Muscles may activate too late, too strongly, or not at all, forcing other muscles or joints to compensate. For example, limited hip movement may cause excessive bending or twisting in the lower spine during simple actions such as standing up or turning. Over time, this added strain can irritate spinal structures and contribute to sciatica pain. This exercise helps restore proper coordination by encouraging balanced muscle engagement in a supported seated position. Posture is another critical factor in sciatic nerve health. Poor seated posture, such as slouching, pelvic tilting, or uneven weight distribution, can place continuous stress on the lumbar spine and surrounding tissues. Many older adults unknowingly maintain these postures for long periods, especially while sitting. The exercise promotes upright alignment of the spine while allowing controlled movement of the hips and legs. By reinforcing proper posture during movement, it helps reduce cumulative daily stress on the lower back and nerve pathways. The seated position is particularly effective for posture retraining because it eliminates many balance-related challenges. When standing, older adults may unconsciously alter posture to avoid discomfort or instability. Sitting provides a stable base, allowing the individual to focus on alignment, muscle control, and smooth movement without fear of falling. This safety factor is essential for building confidence and encouraging consistent practice. Another important aspect of this exercise is motor control. Motor control involves the ability to initiate, guide, and stop movements smoothly. In seniors, motor control may decline due to reduced sensory feedback from joints and muscles. This can result in jerky or guarded movements that increase strain on sensitive structures.
The slow, deliberate nature of this exercise retrains the nervous system to control movement more efficiently. Over time, this improved control carries over into daily activities such as walking, bending, and sitting. By retraining movement patterns, the exercise also helps distribute forces more evenly throughout the body. Instead of the lower back absorbing excessive load, movement is shared appropriately between the hips, core, and legs. This balanced force distribution is crucial for reducing chronic irritation of the sciatic nerve. When the body moves as a coordinated system, individual structures are less likely to become overloaded. An additional benefit is increased body awareness, also known as proprioception. Proprioception tends to decline with age, making it harder to sense joint position and movement. This lack of awareness can lead to awkward or unsafe movements. The controlled pace and focused positioning of the exercise enhance proprioceptive feedback, helping older adults better understand how their body moves and feels. Improved body awareness supports safer movement choices throughout the day. Confidence in movement is closely linked to pain reduction. Many seniors develop a fear of movement after experiencing sciatica or lower back pain. This fear often leads to stiffness, avoidance of activity, and further loss of coordination. By providing a pain-aware and manageable way to move, this exercise helps rebuild trust in the body. As confidence improves, individuals are more likely to move naturally and avoid the guarded patterns that contribute to ongoing pain. From a long-term perspective, retraining posture and movement patterns has preventative value. While pain relief is an important short-term goal, preventing recurrence is equally critical. Poor movement habits, if left unaddressed, can cause sciatica symptoms to return even after temporary relief. This exercise helps establish healthier movement habits that persist beyond the exercise session itself, reducing the likelihood of repeated nerve irritation. Importantly, this exercise does not rely on strength alone. While muscle strength is beneficial, coordination and timing are often more important for pain-free movement, especially in older adults. This makes the exercise suitable even for individuals with limited strength, arthritis, or fatigue. The focus remains on quality of movement rather than quantity or intensity. The exercise also integrates well into daily routines. Because it is seated and low impact, it can be performed multiple times a day without excessive strain. Practicing correct movement patterns regularly reinforces neuromuscular learning, making efficient posture and movement more automatic. Over time, these improvements become part of normal daily behavior rather than something that must be consciously controlled. In summary, this seated exercise supports sciatic nerve health not only by stretching muscles, but by retraining posture, coordination, and movement efficiency. By improving neuromuscular control, reducing compensatory strain, and increasing confidence in movement, it addresses one of the most overlooked contributors to sciatica pain in adults over 60. When practiced consistently, it helps create safer, smoother, and more efficient movement patterns that support long-term comfort and independence.